What are the common problems that occurs in pregnancy? Most women have a healthy and straightforward pregnancy with no major issues. However, even if you're having a healthy pregnancy, you may still have some issues. For some women, these are an inconvenience, while for others they can be more severe. You'll probably be able to manage many of these yourself. They should get better on their own, or with help from your midwife, GP or pharmacist. Every woman's experience is different. Now we can see some common problems that occurs in pregnancy one by one. First common problem is backache. As your baby grows, there's more strain on your pelvis and spine. This can give you backache, which can get worse as your pregnancy progresses. If you have backache, you should do some gentle exercises. You should take care when you're lifting. You should wear flat shoes or shoes with a low heel. You should try sitting and standing with your back straight and shoulders relaxed. You should bend your knees when lifting lighter things and ask someone else to lift heavy things for you. Second most common problem is morning sickness. Around 4 in 5 women feel sick at some point in their pregnancy. Morning sickness usually starts between the 4th and 17th week. It is at its worst around week 9. Morning sickness stops by the 20th week. Sickness can normally be managed by taking care about what and when you eat and making sure you have plenty of fluids. You can get antacids from your pharmacist, or your GP can prescribe anti-sickness tablets if you need them. Severe symptoms may need to be managed by an obstetrician. Third problem is constipation. Constipation is when your bowels don't move as often as usual. Your stools might be hard, lumpy and unusually large or small. It can sometimes be uncomfortable or painful too. Changes to your hormones can cause constipation. You can prevent it or ease the symptoms by these methods: eating high-fiber food, such as vegetables, fruit, beans and whole grain bread. Drinking at least 2 liters of water a day. Being active, taking a walk every day or swimming. You should speak to your midwife, pharmacist or GP if these things aren't working. Fourth one is cystitis. Cystitis is an inflammation in your bladder. It's usually caused by an infection. Cystitis can cause a burning feeling when you urinate. It makes you feel you need to pass urine all the time. As your womb gets bigger, it causes pressure on your bladder and kidney, making it harder to empty your bladder completely. This can lead to urine infections, which can be more common when you're pregnant. If you're feeling uncomfortable, don't wait to see if it becomes an infection. Go to your GP. You may be given antibiotics to take. Fifth one is heartburn. Heartburn or indigestion is a burning feeling around the middle part of the top of your chest. It's caused by stomach acid rising into the tube joining your mouth. You're more likely to get heartburn later in your pregnancy as your baby presses on your stomach. To ease the symptoms of heartburn, you try to eat little and often and slowly. You should take antacids for heartburn, but speak to your midwife or GP for advice before taking anything. Sixth one is swelling. Swelling happens when your body holds on to more fluid than usual. This is called edema. Swelling can be uncomfortable and interfere with daily life. It affects different parts of your body in different ways. It's normal to have some swelling, especially later in your pregnancy. This is usually temporary and settles after your baby's born. It's common for women to feel puffiness in their ankles and fingers, but if your face is swelling too, tell your midwife, GP or the hospital. You may need a larger shoe size if your feet swell up. Choose supportive footwear. Final one is varicose veins. Varicose veins are unusually large blood vessels under the skin that stick out more than usual. Varicose veins usually develop in your legs, but you can get them in the opening to your vagina too. It can be painful and sometimes itchy. Always tell your midwife or GP if you notice any hot, red or painful areas in your legs or vulva. You should know about management of varicose veins. To ease discomfort, you should wear support tights. You should try to rest with your legs up when you can. You don't stand for long periods. Special exercises can help too. Ask your midwife, antenatal teacher or an obstetric physiotherapist to show you what to do. Anemia, obesity also can be common problems in pregnancy. If you have these problems, take action immediately. Thank you.